Hello, my name is Dr. David Manning. I'm a practicing sports medicine physician and the current CEO and medical director here at Group23 Sports Medicine. I'm very pleased that you've taken the time to review this video today, which will introduce you to the concept of care here at Group23. This refers to our approach to patient care, which may be quite different from the typical healthcare experiences you've grown accustomed to with your family doctor and with other specialists. This unique concept of care is encapsulated within what we call our Rise Above patient health journeys, and is the likely reason you've been encouraged to watch this video. So let's begin. At Group23, our purpose is to deliver positive healthcare experiences and empower individuals to rise above injury and back to movement. While the Canadian healthcare system has a lot of benefits and successes, creating positive experiences is unlikely to be at the top of that list. Here at Group23, we believe that the traditional approach to Western medical practice relies too heavily on the assessing and addressing of only physical complaints. This approach assumes that a complaint or a symptom has a physical cause that, once diagnosed, can be remedied by a purely physical treatment, such as medications, injections, rehabilitation, or surgery. Unfortunately, despite many great successes with this approach, many patients have experiences where they do not see improvement or do not get better, which begs the question, why does this occur? At Group23, we believe there are three fundamental reasons for why patients don't respond to the traditional medical approach. The first is a failure of patient education. The second, a failure to conceptualize treatment in the context of a journey. The third is a failure to appreciate the psychological, social, and spiritual domains that exist in a patient's life beyond just their physical complaints. Let's dive into this in a little bit more detail. The first reason many patients don't have positive healthcare experiences is that patients do not fully understand the diagnosis or what is truly causing their symptoms. All professions seem to go out of their way to make up words that only those within the profession can understand. I might have no clue what my lawyer or my doctor just said to me, but they seem to know what they're talking about, so most of us are just too polite to say, "Can you please repeat that in English?" This is a critical error in patient care. We believe that the more patients know about their condition or diagnosis, the more likely they'll be to participate in a proposed treatment. This is why at Group23, we will ask you to become an expert on your own condition. We'll help you with getting the education you need, but we believe every patient at Group23 should be able to explain their diagnosis and understand it inside and out. The more a patient knows about their own condition, the more likely they will understand the treatment plan and become an active participant within their treatment journey. The second big challenge with traditional care is that most patients have no idea where they're going on their treatment journey. A doctor or a physio might have the correct diagnosis and plan in mind, but the patient's left out of the loop. Take these pills twice a day, or do these exercises every day for the next month and come back and follow up and I'll see how things are going. That may seem like a plan, but in our opinion, it's simply not good enough. At Group23, we want our patients to understand every treatment decision and actively participate in the decision-making process. Using our Rise Above patient health journeys, we aim to provide patients with a roadmap of their treatment journey that is squarely aimed at a target we call their Rise Above goal. Once we have the destination and the roadmap to get us there, we will go above and beyond to support our patients along their journey so that they will be successful in reaching the Rise Above goal. The final reason we see that many patients have negative experiences or fail to get better is that many healthcare professionals fail to take a biopsychosocial spiritual approach to care. No two individuals are exactly the same, and none of us inhabit a world that is purely physical. Rather, our day-to-day sensations, responses, and reactions to injury, pain, and disability are part of a broader, global experience that involves the complex interplay between biological, which is physical, psychological, which is the how and what we think, social, which is the world we live in, which includes our friends, families, schooling, work, and finances, and for some, spiritual factors. Each of these domains contribute uniquely to a patient's experience as well as their response to treatment. If the patient or the care team fail to appreciate that there are broader psychological, social, spiritual factors at play underlying the physical complaint at hand, then treatment runs the risk of being incomplete, and thus not being successful. The end result of that is an unsatisfactory outcome, delayed or incomplete healing, and oftentimes chronic pain and frustration. It is for this reason that at Group 23, we want our patients to know that we know they're more than just a knee, a hip, or an ankle. Rather, you're a unique individual person with lots of things going on in your broader life. Our unique approach to patient care considers and respects these realities as we strive to support you along your Rise Above journey until you reach your Rise Above goal.